Any other questions? I would open now for questions. Anybody who wants to ask any question, I open it up to the floor.
You have not told us how to use the gadget yet.
Oh, okay. Okay, I presume that everyone uses it. Okay. Actually, there is a video on how to use it, but it's very easy. This is because I don't think you can see it. You can see now, this is blinking, it's auto. Do you own the medical device? Oh, okay, okay. How many times are you using it a day? 0. Okay, please use it. I beg you to please use it because you want your body to be on tip-top condition. So when you press the blue button, okay. Okay. When you press the blue button, you will see the time. And then when you press another button, it is actually on the intensity is 3 bars on 30 minutes. This is actually the one for the nasal therapy. So when you press it, so you do the nasal therapy. Yeah. So you do, this is actually the main therapy. I will send a video to Susan and to Joseph, and then they can send it to you. Would that be all right? A video on how to use it.
Angela, I'll be seeing them this weekend. I can teach him how to use.
Okay, sure, sure. Okay.
I'll show you this Saturday.
Yeah, okay, okay.
I have one question. What about people who have constant seizure or epilepsy? You think you should encourage them to use?
Yes, just use this.
How do they use it?
The nasal therapy. Yeah, just do the nasal therapy. I would actually encourage for first-time users, if you're on high medication, first-time users, use 2 bars for 20 minutes for the first week. And if you find that there is no healing crisis, carry on to 3 bars, 30 minutes. Yeah, we always like to go slowly first, because some people, when they take a lot of medication, then they will have healing crisis. Actually, healing crisis is good because it actually shows, the body actually tells that it's reacting to this light therapy. So it is actually a good sign. Any other question?
Can I ask a question?
Yes.
Is it safe for rheumatoid arthritis who's on medication a patient to use?
Yes.
Because it's autoimmune, you know, because it may aggravate the autoimmune, yeah.
No, it doesn't actually. Actually, what you can do is, you can actually add, type in this actually, this therapy is either called low level LLLT, low level laser therapy, or you can also call it photobiomodulation therapy.
Yeah,
If you can just Google out, you know, LLLT and rheumatoid arthritis, it will come up. How I have got actually people with rheumatoid arthritis, and their rheumatoid factor actually dropped after using it for a while. It keeps on dropping. When they do it will drop. So like as I say, when you are doing a therapy, do it constantly, diligently. Like when you wake up in the morning, you do it once, and then after 4 or 5 hours, use it another time. So if you can, for healing purpose, 4 times a day. For maintenance or preventive medicine, you can do it 2 to 3 times a day. Okay, there is also another therapy, we call it target therapy. Target therapy where there is pain in any parts of the body, like their tennis elbow, they cannot bring up their hands, you know, then you place it where the pain is, and that is on 4 bars, 40 minutes. Target therapy, you can continuously use it. We actually have a few people who are in constant pain. I would share with you this story of a friend of ours. He actually had a spinal injury, and he is on constant painkillers. Okay, and his description to us is when he lies down in bed, he sleeps at night. The next morning, when he wants to wake up to sit up straight, it will take him half an hour, because the pain is excruciating pain, is so painful that it takes him time to sit up. So when he started using this therapy, it was, I think, in less than 3 weeks, he was no longer on painkillers, and he's back to normal. He could sit up without any pain, you know, getting up from the bed without any pain, and he doesn't need any more surgery, because doctors were recommending him surgery. So how my friend used is, he did the nasal therapy, maybe 2 or 3 times a day, but he did target therapy at the back on the spine, and he did it again and again and again, almost continuously until the battery runs out, and then he would charge it again and use it. So that actually brings down the inflammation, and it heals the body. Any other question? Any?
ค่ะ Angela, will it help insomnia, like unable to sleep well?
Yes, definitely. I have got actually a lot of people. One of it is actually my ex-colleague. She couldn't sleep at all, and she says every day, you know, hardly 1.5 hours to 2 hours of sleep, because she'll be wide awake. And I asked her to use this. Actually, she achieved actually going off without any sleeping tablets in, I think, less than a month. And today she says she sleeps like a baby. And for men too, where your prostate is weak, you can actually put it, you know, three fingers below your navel, place the medical laser there, the iron laser there, put it 4 bars, 40 minutes, put it that. We have actually a friend in Sarawak. He goes to the toilet very often at night, and he says most of the time he's not able to reach the toilet because his pajamas will be wet. And we actually sent him the iron laser to him. The first day he used it, he said that night he didn't need to wake up anymore. You know, he doesn't need to go to the toilet, wake up to go to the toilet anymore. Just one, you know, the one night's use only. So for him, in his case, wow, his healing is so fast.
Yeah, Angela, what about gout? People with gout.
Yes, okay. Gout, as I was sharing earlier on, doing this therapy, it takes away the free radicals and all the toxins out of your body, even, you know, the dead cells out of your body through your urine and all this. So for those with gout, it actually takes away the uric acid out of the body. We have got a friend actually who he gets gout very regularly, like 1 month, a few times. And he bought this very expensive chair. I think it's called Dr. Cosmos. He bought the expensive chair thinking that it would help him, but he still had gout attack. When he tried using this, his gout just went off over time. So when you have got gout attack, that's what we say. When you do this therapy, drink a lot of water before and after. For me, I find that the best time for me, because I'm quite busy in the daytime, I do it in the day too. Whenever I have the chance in the car when I'm traveling, I would do it. But at night is the best time. I would do twice at night when I sleep. When I go to bed, I would just put it on, and actually within 2-3 minutes, I'm already asleep. My husband would talk to me, but I'm already deep in deep sleep. And then at night, should I wake up at night, I would just automatically put on again and do another therapy. And I find that the best time to do this therapy is when you're sleeping, because when your body is in a resting mode, all the organs are resting, and that's the best time that the body will heal itself. And also the detoxification of the body will be also during the time when your body is resting. Any other question?
Do you have any clients who has a neurogenic pain? You know, they have unexplained pain all over the body every now and then.
I think that's because of the, it could be due to a lot of toxin in the body. It could be due to uric acid. It could be also nerve, because there's not enough blood flow in the body. The blood in the body doesn't feel well. So when you do this therapy, you will actually discover that a lot of all these problems that you have will just disappear. It will just go away.
Yeah, Angela, it seems to be too good to be true. What about how long do you have to take it to use it before you can see any results?
Okay. From my experience, from what we see for those in the healing ministry, in the Vantros Healing Ministry, actually, by the 3rd week, in a month, you can see a difference already. You can truly see a difference in the way how your body react, the healing process in the body. It will, like for me, in my case, you know, it was really bad. My nerve was all dead. You know, a lot of my nerve was dead. I couldn't even feel the floor when I walk. And in 3 weeks, I got the feeling back. Oh, I forgot to share with you one very, it's a miracle, I would say. When I took the COVID jab, the 3rd jab, I actually had a reaction to it. My eye totally shut down. You know, just I cannot open my eye. And if I were to open my eye, I would, like, the whole world turns around. I was actually rushed to the hospital emergency, and then they took my blood 2 times. The first thing is to do a scan. You know, they thought that I had a stroke, or for me, I was thinking, oh my, there's a growth in my brain, but everything was all cleared. So they did a check also onto my heart. My heart is okay, perfect. The acidity, blood acidity is normal. It's not, it's normal. The pH is okay. There's no infection in my blood. And so I went from one doctor to another. The eye specialist told me, Angela, it will take, because the nerve is dead, it will take you, it would be a bonus. He said, it would be a bonus if you can open your eyes in 6 months. He said, it would be a bonus. And I told him at that time, I was, very gung-ho. I told him, I've got this medical device. I think I can do it in 2 months. And guess what? I opened my eyes in 1.5 months. Yeah. Why? It's just this therapy. Because this therapy, it helps with the blood circulation. It does acupuncture, non-invasive acupuncture to the 361 points in the body. And it also have the magnetic therapy where it encourages blood flow in the body. So when doctors, specialists say, it will take time, but with this personal doctor of mine, personal specialist of mine, it cuts down the time. I forgot to tell you, the eye specialist went in to see whether there's any degenerative, thing in my eye. Nothing, everything was perfect. Yeah. And it was actually my endocrine doctor that told me it is the vaccine.
Oh yeah, Angela, it seems really very miraculous. What about does it have any side effects at all? No side effect at all?
There is no side effects. As I say, this is non-electric. There's no electricity run, only light. You see, when God created light, life came. When God created the sunlight, there was life. And plants and human beings, we need light in order to be healthy, to live. So this is actually a small spectrum of the sunlight. Scientists found out that this small spectrum of the sunlight really helps in healing of the body. Perhaps in Malaysia, we don't see so much of low-level laser therapy in, but if you go to Australia, you go to the West, you go to America, there is a lot of clinics that does this therapy. Yeah. I think in Malaysia now is catching up. Doctors are getting to know more about this now. Yeah. And yeah, I would just like to share, Christy, if you can go to the certification part. This is actually a certified medical device, and in Malaysia, it is registered with the Ministry of Health as a medical device. Yeah, the certification of this medical device done by MedCert in Germany. So it is under ISO 13485, and it is a class 3R medical device. So class 3R means it's non-invasive, it is safe to use, and it is for therapeutic purpose. The motherboard is patented in the US. In 2019, this medical device that I'm holding got a silver award for medical device. Every year in Geneva, in Switzerland, there is a world exhibition of inventions where corporations, universities, scientists, they would bring their product over, their findings to exhibit there. And then the judges, of course, they will go through, they would go through all the, what they call the research and all this. And this actually got a silver placing for medical device. So if you have owned this medical device, this is actually a branded medical device, and it is so reasonable. It would actually save you a lot of medical bills. Any other question?
Can I ask a question?
Yes.
I'd like to know if you have seen any cases, people with severe osteoporosis. Do they get healed with this?
Okay. It actually strengthens your bones. When you use this medical device, it actually strengthens your bones. So the brain would instruct the body to produce stem cells, and where the bones is concerned, it will strengthen the bones.
It will strengthen the bones. What about if the person had very severe scoliosis and all that thing? It will not do
okay.
anything.
Scoliosis, okay. I'm in Kuching. He is actually our case in Kuching. He said that actually he has like his backbone is actually bent, and scoliosis, like you call that. And he says now is straight. So he didn't even realize it. But, the spine just got straightened. And I have also seen two cases where, when sometimes if you go out, you may see old ladies that have their back is so bent because the backbone is so weak that they bend down, like, almost 90 degrees, maybe 70 degrees. They bend, no, more than that. So we have got actually this person, a friend of mine. She's actually not very old, but because her bones were so weakened that she really, she walked very like looking down on the floor. And actually, our CEO actually told her, just use this and then use the light to shine on the backbone. So she did that. And then today she's walking upright.
Oh, that's amazing.
Yeah, she's walking upright. Yeah.
So you would advise target therapy as well as standard therapy?
Yes, standard therapy and target therapy. And of course, there is also certain exercise that she needs to do to strengthen her muscle, because the muscle has already pulled the bones down in that sense, So to strengthen, there's certain exercise that she needs to do. So normally this therapy, we do it with adjunct therapy with something else. Like in this case, it is certain exercise that you need to do to strengthen your muscle.
I see. Because I've got very brittle bones, very brittle bones.
Then start using it. I would advise you to start using it.
I see. I thought there was no hope for me.
No, there is hope. There is hope, yes.
May I
Angela.
know, you're putting on your forehead, what is that for?
Yeah, okay. The reason why I'm doing this is because I want to show you all this is part of the therapy. For those of us in, I am in the 6 series already, in the 60s, to keep our brain health, it is good to use this. To do this, of course, we don't let it blink, we do target therapy. This is actually to stimulate our brain. And it is also good for our eyesight. The only thing is do not shine the only thing about this therapy is do not shine the laser into your eye, just for me today, I used to use glasses, but today I do not need reading glasses. I can see far, I can see near without any glasses.
What about if you get constant headache at the back of your head all the time?
For those who used to have at the back, is it do the normal therapy plus there are 2 spots at the back. There are 2 spots at the back here.
Sit down.
And,
I cannot see you.
oh, okay. Do the what they call at the back of the neck here. Just do the target therapy at the back.
I see.
Hi, Angela. I got 2 these iron laser at home, one for myself, one for my wife. If my wife not using, can I use it simultaneously? 2 on
Yes.
my body, 1 on my nose, 1 on the target, no problem.
Okay. My husband and I, both of us have 2 iron laser each. And at night, I will put it in my nose and then another one on my navel.
Okay, good. Thank you.
Yes.
I won't get overdose.
No, it's not overdose. It's only light.
Okay.
It's
great.
only
Thank
light,
you.
650 nanometers of light. Yes.
Angela, what happens if we overuse too many times? Is there
There is non-invasive. Do you, okay, at home at night now, you are sitting under light, right? Do you like say, okay, now I'm overdosed, I switch off the light and I'm in darkness? No, this is just light. It's actually healing light. It is not dangerous light. It's healing light. So it's okay.
people with knee pain, all right, where would you suggest them to target? Or how
Against, I can't hear you.
they have knee pain?
Just target at the knee. Put it on at the knee. We have got people actually, I've experienced it too, yeah. When we were traveling and they just, how to say, sprained their ankle and then it was really swollen. And so this friend of mine, she just did, she couldn't even walk and couldn't come for dinner. And she just did target therapy 6 times. The next day she showed us, in fact, I have her testimony in the bus. She was jumping on the bus and sharing her testimony. So it really helps to bring down inflammation. The sooner you do it, the sooner we address the issue, it will heal very fast. For those, I would encourage you, for those of you who have not got the IM laser yet, get them this month because next month the price is going to increase. Yeah, purchase them this month.
Angela, do you keep any statistics on all these cases, especially on Parkinson cases?
Okay, I have come across 2 to 3, actually 3 Parkinson's case. My first one was actually this 80-over-year-old Dato. He loves driving, sports car. He's got sports car and all this, but he's got Parkinson's. So he couldn't drive. He's another one. He couldn't drive at all, and he came over. His friend actually brought him over to the Vantros office. I was there with him, explained, and then he bought the Imlaser. 3 weeks later, Datin called me and said, Angela, I'm going to return the medical device to Vantros office. I say, why, Datin? You know, Angela, Dato now is chasing me all over the house. He has become sexually active again. Yeah, 3 weeks. 3 weeks, you know, Parkinson's. Yeah. We know of another Chinese traditional medicine doctor, Sincere. He had actually severe Parkinson's. He couldn't drive at all. He was, I think, the 4th stage of Parkinson's already. And when he started using this, after a few months, he actually could travel. And then he could go back to the park again, you know, exercising in the park again. So so these are the cases that we know, we see. But Parkinson's, as I say, is electrical. It has to do with the nerve connection. And this is actually very good. The photobiomodulation therapy is really very good. Yeah. What else? Actually, I have got so many sharings that I do not know which one to share. But what I would say is that, you know, for those, we realize that when we see, for those with hypertension, high blood medication, this would definitely, if you use it for 6 months to a year, you will be off your high blood pressure medication. My husband used to be on medication for many years. I can't even remember how long. And when he is on medication, the blood pressure is still high. So doctors keep on increasing. When he started using this medical device, his pressure keep on going down, okay? Until he took off the medication and it's back to normal. And doctors say, no, he doesn't need to take the medication again. So it really helps. We have seen also dialysis patient, kidney dialysis patient, because their kidneys are already, you know, not working. And when they do the normal therapy and also placing it at the kidney area, they're able to cut down on their on going for dialysis. And they could even feel, you know, the sensation coming, and they're able to also pass urine. Yeah. So it is really amazing. Amazing. Why doctors are not, there are some doctors that's really passionate about sharing this good news. The wellness doctors, they would be the one recommending. Many doctors, I would say, you know, they do not know about this photobiomodulation therapy because they do not study it. Many doctors, they find that, you know, wow, this is really amazing, it's really impossible. But because they are not in that field of study, they do not know it. I'll just like to share my story, ending my story. There's this COVID then came, and then I didn't go to, I used to go to IKN to go and see the oncologist there for follow-up. 2 years I didn't see them. For a few years I didn't see them. So I actually called them up to make an appointment to see the oncologist. And I am known in IKN there because of my severe case, you know. And the staff nurse called me back and say, can you come at such and such a date? And I say, yeah, okay, I will go. And when I went to IKN, Institute Cancer Nagara in Putrajaya, meeting me was actually the assistant director of the hospital. She was really so keen to know, why am I still alive today when, according to their prognosis, I should be gone, you know, and I'm still alive today. And she was so glad to see me. And of course, you know, with all the tests and everything. And she said, it's really amazing. She said, I don't need to see an oncologist anymore, but she would like to follow up with me every year to see how I am. She said I should just see a wellness doctor. And she was really amazed by my recovery. So as I say, where medical science say there's no hope, in this device, there is hope. Our body is actually created by God, and it's a very intelligent body. But because we humans, we abuse our body, that's where sicknesses and illnesses comes in. Yeah. So I would urge all of you, use it diligently. For those friends that's suffering from any ailments, share with them the good news that there is hope. There is hope, really.
Hi, Angela, any testimony on graying hair, like my hair graying?
Actually, there are some, but my hair is still, you know, I do not know whether there is actually some that their hair turning black. Some, but I do not, you know, notice those, you know, not life-threatening. Yeah, this is life-threatening, so I don't follow up, but there are cases. Any other question? Anything? Because of my healing, I'm really passionate in this healing ministry. I would just like to share the good news for those who, you know, cannot find any other alternative. I would share this good news with you. Like, for example, cancer. All we know is chemotherapy, radiotherapy. I have known of cases. I used to, at one time, journey a lot with cancer patients. Many of them perish because of the chemicals in the body, the chemotherapy in the, you know, in the body. Some of them just bled to death. But there is hope. I've got friends too who do not choose the normal way, but go on natural therapy, like using this as one of the adjunct therapy, and they are healed of cancer, 4-stage cancer to 0 stage. And actually cancer that's 1st stage, 2nd stage is actually very easy to address. Any questions?
Angela, did I get you correctly that for cancer cases, it is Imlaser is a very good adjunct therapy?
Yes.
Plus,
yes.
The usual medical therapy, right?
Okay. Okay. I just want to. Please do not take my word, but I think you need to make your own decisions. I can only share based on my decisions, based on my experience. Actually, recently I lost a good friend, a very good friend. She actually had 4-stage cancer. When she started using the iron laser and doing a jump therapy, she was getting very well. She was even cooking for me and then sending me her favorite cooking she would send me. But because of family pressure, they told her, no, you know, you better continue on your chemotherapy. I saw her blood profile and I actually told her, be a bit, think twice, because it will really cause you will bleed, you know, when you do this chemotherapy. And true enough, because for her, it was family pressure. She took the chemotherapy and she bled to death. Yeah, I lost a friend. Yeah. I'm just here to share. Yeah, I'm not a doctor, but based on the experience, and I also journey with in our healing ministry. We do have doctors that is also in the healing ministry, so they do, you know, share their experiences too. So there have been many good results in. Yeah, okay. I just want to share something too. For those who are doing the therapy in the beginning, it is good actually to keep our body alkaline. Lemon juice is one way to keep our body alkaline. Yeah, when we do the therapy, because we don't want our body to be too acidic. Because if you find, you know, cancer patients, those who have taken chemotherapy, normally their body, their blood acidity is very high. You know, very acidic. So when we want to do the therapy, I also encourage those with cancer and without cancer too, keep your body alkaline. One of the ways is, like as I say, lemon water, drink them. Another easier way is bicarbonate of soda, 1 teaspoon. When you wake up in the morning, just put 1 teaspoon of bicarbonate of soda in warm water. Drink it before your therapy. So when your body is alkaline, it will be good for the body when you do the therapy. Oh, okay. It's 10:15 now. Any other question? Otherwise, you know, I can be contacted if you have got any personal, for those who are using this, and if you want to ask me personal question, you can always get my phone number from Joseph or Susan, and then I would really like to help you and see how we can, you know, we can advise you on how to use this medical device. Susan?
Yes, Angela?
Yeah, do you want to end now, or is there any other question?
I think there's no more question. We thank you so much for your time and your explanation and your testimony shared with us. Yeah, just hope that it has benefited all of us. Yeah. Thank you.
Yes, thank you. So I would, yeah, encourage all of you to use the iron laser diligently. For those who have not got it, get it one, at least one to be in the families. My husband and I, we have 2 each, get one, and that it would certainly help to address any issues that you have with your body. Yeah. Okay. And I truly thank God that I have this opportunity to speak to you too. Today, it is not me standing here, but I think God has given me the opportunity to share the good news with you. Yeah. So it is really a grace from God that I'm here to share with all of you. I really truly want to reach out to as many people as possible to say that, there's still hope in whatever it is, there's still hope. Yeah. And I'm sure all of you want to be young, right? So we want to live young, we want to be healthy and live healthily. Yeah.
Yeah, Angela, maybe the last point you can share with the ladies that this also helps with facial. I mean, they can look younger.
Oh, okay. Actually, recently, Vantros has come up with, I've actually been to this factory in Korea. It's actually, they use stem cell to make this mask. And it is actually a wonderful mask, really a wonderful mask. And it really helps to firm up the skin. And also for those with uneven skin tone, it would help too. There is an offer this month. Maybe I can post it to you and you can share it with your friends. Okay, this IM laser, you can also do facial. Yeah, facial, I would share with you, and maybe you can share with your friends how to do facial with them, with the IM laser. And actually, there are also studies that shows that it also helps to reduce wrinkles. I actually have I don't call it a birthmark, but I have a mark here, a brown patch here on my face. And I didn't realize, and I used, to cover it with those, what do you call that? Yes. But today the mark has disappeared, it has gone. Yeah. So it really helps to renew yourself. Yeah. So any other question? One last call, or else I will I thank God for you coming tonight, all of you, listening to this sharing. And